Okay, thank you guys for coming out tonight. My name is Dr. Bemis, and tonight we're going to be discussing workplace ergonomics and how we can help make your workspace a little bit more efficient and maybe prevent you from suffering some of the most common workplace musculoskeletal disorders. So we'll talk about some of those disorders, what ergonomics is, then a little bit later we'll go over proper lifting technique. I've got some really good slides on here that demonstrate that. And the very last little bit is going to be how to modify your workstation to make it as efficient as possible for your body. So what is ergonomics? Well, ergonomics is the study of people's efficiency in their workplace. So how does their body function in the space that they're working within? The term ergonomics is derived from two Greek words. The first part is ergon, meaning to work, and nomoi, meaning natural laws. In other words, the study of how someone works in their environment. One of the most important reasons for ergonomics is to prevent these. Work-related musculoskeletal disorders. For the purpose of the presentation, we'll refer to them as MSDs for the duration of this talk. And work-related MSDs will typically affect the muscles, nerves, blood vessels, ligaments, and tendons. So they can have a really negative effect on your body if they're allowed to occur. Workers in many different industries are prone to these, whether it's regardless of occupation, and there are various risk factors. Underlining it all is they're very preventable. So work-related MSDs are incredibly preventable, and they usually occur due to a workstation that does not suit a person's body. Some common work-related musculoskeletal disorders would be carpal tunnel. That's a big one that we see in typists or anybody that spends a lot of time at a desk working with a keyboard. Towards the end of the presentation, we'll talk about how you can set up your desk and workplace to be more efficient and fit your body. Tendinitis. This is the overuse or inflammation of any tendon that you have in your body. Tendons they connect the bone to the muscles, and they can become easily inflamed if they're overworked in improper motions. Rotator cuff injuries. The rotator cuff are the bunch of tendons that stabilize the shoulder, and they commonly go out on people that work in factories, or it's actually a common issue in chiropractors as well. Epicondylitis, that's inflammation of the medial epicondyle or lateral of the elbow. I'm currently dealing with a nasty medial epicondylitis, and it's not fun. Trigger finger, and then muscle strains and low back injuries are some of the other common ones. So the MSDs have many impacts in the workplace, some of them being listed right here. They're the most frequent reported cause of lost or restricted work time. So the bulk of most workman's comp cases that various businesses see are due to the previously listed MSDs that we discussed. And according to the Bureau of Labor Statistics back in 2013, MSD cases accounted for roughly 33% of all worker injury. So that's a third of all injuries were accounted for by these MSDs that could have been prevented if properly addressed. So what are some of the benefits of workplace ergonomics? Well, number one, and I think all business owners can get behind this, reduction of cost. It's estimated that $1 of every $3 in workers' comp cases are attributed to MSDs. There's that 33% again. And it's believed that the indirect cost of these MSDs can be up to 20 times the direct cost of an injury. So those costs really start to add up. You know, a simple carpal tunnel case, all of a sudden that results in whether it's chiropractic care, then physical therapy, and then God forbid at the very last resort surgery. A lot of times, unfortunately, chiropractic care is thought of last in regards to that, which it should not be. Second benefit is improved productivity. If you tailor a job, a specific task to a person's body type, and you tailor their work environment to their body type, they will be far more efficient and their body will not wear out as easily. We'll discuss this in just a little bit. Benefit number three, improved quality. Poor ergonomics leads to a frustrated and a fatigued worker. Their body is going to wear out more quickly if their workstation does not suit their body type. And lastly, improved employee engagement. If a workstation is suited to an employee and they're not getting hurt all the time or they're not injuring themselves, there'll be decreased turnover, meaning they'll be more likely to stay at their job longer. There'll be decreased absenteeism, meaning they'll be taking less time off of work. Increased morale and increased employee involvement. All these are great things that will really help improve the working environment. So what are some of the risk factors for ergonomics that we take into account? Well, number one is high task repetition. So any motion that requires high task repetition means the repetition cycle must be 1 time per 30 seconds or greater. So think of your factory worker or your typist. That could be a high task repetition, typing resulting in carpal tunnel over time. Stacking boxes in a factory or working on a line, a lot of high repetition activities, that's a great risk factor for musculoskeletal disorder. Number 2, forceful exertions. Your muscles will wear out more quickly, or they'll wear out more quickly the more force you're outputting. So if you're involving a high repetition motion, and then you couple in force with that, now you've increased your risk twofold. And lastly, repetitive, sustained, awkward postures. These are carrying out a task or a motion that your body is able to produce, but in a compromising position. So let's say, an agricultural worker picking crops in the field. They're bent over, weeding, picking all day. This is a very compromising position for the body. And then, so that right there it's both a forceful exertion as well as high task repetition. These things will all snowball and could result in a musculoskeletal issue. The next couple slides here are going to discuss proper lifting technique, and these slides do a great job showing the right way to lift. So number 1, start in a safe position. It's recommended by the Mayo Foundation for Medical Education and Research that you assess the situation and what you're going to be picking up. How heavy is it? What is it shaped like? Can I get my arms around it? Do I need help having someone lift this with me? So number 1, assess the situation, get as close to the object as possible, because if you're lifting it up, you want your center of gravity, you want this to become a part of your center of gravity, so it would be more beneficial to pick it up close to the body than out here, right? Number 2, maintain the natural curve in your low back. Now you both learned throughout your time here what the natural curve in the low back should look like. We like to see that well-defined lordotic curve in the low back. And you can see right here, this gentleman, he's maintaining that curve. He's in a nice neutral posture, and he's still keeping that box tight to his body. Step 3, use your legs. This is probably the most obvious one. You always hear people say, lift with your legs, not your back. This position right here is a lot stronger than lifting like this, because again, that's a very compromising position for the lumbar spine, and that's a very easy way to blow out a disc. Another option would be to squat instead of kneel. So the first slide discussed you can get down on one knee and kneel. Me personally, I don't feel very strong on one knee, so I would rather squat down, have my center of gravity nice and close, and then bring that object up really tight to the body. Last slide here, allow your legs to do all the work. You'll have some low back involvement. If it's a really heavy object, it's unavoidable, but these are some of the most powerful muscles in your body right here. So you want those to be doing the bulk of the work. And lastly, avoid twisting. Twisting is a very, very compromising motion for your low back. If you're not lifting anything heavy, some range of motion like this is great for it, but if you're carrying a heavy box and you're stacking or moving things, that's a very compromising position for your low back, and it could result in an injury long term. One of the very common acute cases we see in winter living in Wisconsin is snow shoveling injuries. People are shoveling and they're throwing like that. And if we get a really heavy wet snow, it doesn't take long for someone's back to go out, as they say. So number 6, avoid twisting. What is Tex-Neck syndrome? Have you guys heard of Tex-Neck syndrome?
Yeah.
So Tex-Neck syndrome it's not a workplace, well, it could be a workplace musculoskeletal disorder, but it is a musculoskeletal disorder of the cervical spine due to spending an excessive amount of time looking at technology or staring down at a screen. Now, it doesn't have to be a handheld device to cause this. It could be you just staring down at a computer screen that's way too low for your body. So Tex-Neck syndrome is the term used to describe the stress and strain that the cervical spine is placed under due to that forward head posture. This diagram right here does a great job showing the varying degrees of anterior head shift, meaning how far is the ear out over the shoulder. So in a neutral position, there should be 0 degrees of anterior head shift, and the average human head weighs about 10 to 12 pounds. So that's what the amount of weight that your body was designed to carry. So that neck is able to carry 10 to 12 pounds very easily in the neutral position. 15 degrees of anterior head shift results in a doubling of the weight of the neck. So just 15 degrees, that's roughly a centimeter of anterior translation. Now you're up somewhere around 20 to 24. This diagram says 27, so it's pretty close. 30 degrees, now we're about 2 centimeters out. That's 40 pounds of weight being placed on that neck. Now let's get out here. We see in our waiting room a lot of times kids staring down at their phones, looking just like this, or God forbid, face down at the floor like that. 60 degrees of anterior head shift translates to about 60 pounds. So that's a lot of extra force being placed on this part of the spine right here. And we're seeing this kind of subluxation pattern in kids as young as 10 or 12. Forward head posture can cause permanent damage if left unaddressed, and these are just a couple of the laundry list of things that can result in. headaches, back pain, muscle damage, nerve damage, disc herniations, decreased spinal curve. So this is close to what a normal cervical spine would look like. And you can see right here, this is what it looks like when you're constantly looking down at your cell phone. That places a lot of pressure on these intervertebral discs, stretching the ligaments out, and it can just result in a lot of aches and pains down the road. So I always tell people, if you got to spend time looking at your phone, either bring it up to eye level or hold it slightly elevated and avert your eyes downward. Alright, the last section here before we conclude this presentation is going to be about a physical workstation at a desk. This is a pretty neat diagram because it shows all the things that are wrong with this picture. So you can see right here, one of the things regarding this chair, this gentleman's back is not being supported. So that's going to increase or exaggerate the curve in his thoracic spine. That could cause some strain after a while. You can see right here his neck is turned to the left. He's trying to look at his monitor. Again, twisting is a very compromising position, and if you do it for a prolonged period of times, it could cause problems. Ideally, you want your monitor positioned head on so you're not looking off to the side like this all the time, and we'll go over that in a few slides. This gentleman's mouse is too far away from his body, causing him to extend and reach, which could lead to a carpal tunnel issue. And finally, I like this part, cacti are meant to grow in hot, dry environments, not in an office. So we'll start with the chair. What are some characteristics of a good office chair that'll help increase your level of comfort and prolong your working ability? Well, number one, it should support your spinal curves. You can see right here on the spine, the three well-defined curves. We have that C-shaped curve in the neck, that reverse curve through the mid-back, then another elliptical or C-shaped curve in the low back. And you can see right here how this chair kind of is designed where it's going to caress that lumbar spine right there and then provide room for the thoracic spine and then support that area. So you can see a lot of the chairs, if you take a look at them, are ergonomically designed to support these curves. In addition, there should be enough cushion to support your body, but there shouldn't be such a bulky cushion at the front there that it's compressing your sciatic nerve as it travels down the leg. Number two, your chair should be low enough that your feet can rest flat on the ground. If your feet are constantly dangling there, that's not a good thing. Thighs should be parallel to the floor, and your armrests should be low enough or high enough to allow you to rest gently with shoulders relaxed in this position. So if you have armrests that are forcing your arms up like this, that could result in impingement syndrome up here in the thoracic outlet area. So to wrap it up, support the spine, feet flat on the ground, and thighs parallel to the ground as well. Alright, telephone. This is very common. Anyone that talks on the phone a lot and has to type, whether it's a receptionist or a secretary or an administrative assistant, if you frequently talk on the phone and you're able, let's say you have your own office, maybe consider putting it on speaker. So that way you're not constantly having to cradle it between your head and shoulder like that. This picture does a fantastic job showing what happens to your spine when you're compressing something in between your ear and your shoulder. So we really want to avoid doing this because this is what your spine should like while sitting down in a neutral position. And you can see that big shift right there. And if you do this, you can imagine if this woman does this 10, 20, 30 times a day, 5 days a week, X number of weeks a year, that cumulatively adds up. And you're looking at some degeneration in this part of the spine very quickly. A better option than speaker, if that doesn't work for you, is use a headset. Keyboard and mouse. They should both be on the same surface within easy reach, so not too far out so you're constantly extending one arm or being in too tight. Nice neutral position. And you want your wrists straight when you type. I remember being in an elementary typing class. This was just when computers were starting to become a big thing. It seems like forever ago. And I'd always get yelled at because I'd have sloppy wrists and I'd be letting my wrist drag down. Well, I didn't know at the time, but my typing teacher had my best interest in mind. You got to keep your wrists straight and nice and reinforced so that you don't run into carpal tunnel issues or any sprains or strains in the wrist. And lastly, if you're ambidextrous enough, try and switch up hand usage for the mouse. It's a great way to retrain your brain as well as give your mouse hand a break. So you can see right here, this is perfect typing posture. This is bad because it's too high. And this is also bad. This is what I'm constantly guilty of. I'm always checking myself on that. Alright, now your desk. Your desk should provide enough clearance for your knees. So if it's too tight and your thighs are constantly compressed underneath your desk, we don't want that. Consider if your desk is very high or if your chair is too high, consider a footrest to support your feet as necessary. We want to try avoid storing items underneath the desk like these cabinets right here because you're going to constantly be bending over to grab things. A lot of time there's some turning and twisting involved. We'd like to avoid that as well. And lastly, if your company or your business allows to do so, take advantage of a standing desk. Computer monitor, it should be directly in front of you, roughly at an arm's length away. And the top of the screen should be at or slightly below eye level. So you can see right here. Hello there.
Hi.
You can see right here how this gentleman, it's just at eye level and he doesn't have to look down at it, he doesn't have to look up. Spine's in a neutral position and he's looking just down at that eye level of the computer there. Top of the screen should be at or below eye level, we discussed that. Monitor should be directly behind your keyboard. And if you wear bifocals, it's recommended that you lower your monitor an inch or two to provide more comfortable viewing so you're not constantly having to look down. Alright, so now we're to the quiz portion of the presentation tonight. I'm going to show you a few pictures and you tell me if you think that this is an example of good or bad ergonomics from some of the techniques that we discussed tonight. So you think this is an example of someone who's doing a good job lifting up this box or a poor job?
Say good.
You would say good? I would think so too,
Thumbs
right?
up.
Thumbs up.
Thumbs up, I like that. You can see right there, they're using the squatting down method. They're keeping that box very close to their center of gravity and using their legs to lift up. Alright, this young lady is trying to eat her lunch and she's talking on the phone in her office. Now, do you think that this is a good or a bad example of how to use your phone at your desk?
No.
Thumbs down, right?
You're cradling.
Exactly. She's cradling that phone in between her head and her shoulder, which is going to place a lot of strain on that cervicothoracic junction.
Consider a headset.
Consider a headset, thank you. And plus, nobody wants to talk to someone on the phone when they're eating lunch.
Oh yeah.
All right. Aside from this desk being a disaster, do you think that this is an example of good or bad office space ergonomics?
Whole thing's wrong.
Everything's wrong. What do you see wrong in there? Just give me two things.
Her legs are crossed and she's turning at an odd angle to see her computers off to the side.
Yeah, no, and maybe this is just a bad picture. You know, maybe if she turned her chair a little bit, her chair might be the right height and she can look straight on, but yeah, you hit it on the head. She's twisted, so that's a very compromising position. The computer looks a little bit high for her actually, or her chair's too low, one of the two. And like you said, she's sitting with her legs crossed, which over time could cause some aches and pains. Alright, this is pretty obvious. Is this guy doing a good job or a bad job lifting his boxes up?
It's got it close to his body.
He does. You can
Nothing
see,
else.
Nothing else is right. You can see right there that big, he's really reversing that lumbar curve. And you know he's working hard because the forehead
I was gonna say,
is
is that
pretty
a
strong.
is that-
Yeah, so this is a bad example. Thumbs down. You guys have probably seen this slide in our doctor's report before. Is this a good or a bad example of sitting looking at your phone?
Bad.
This is kind of tricky. I'm going to say bad because the head is really far over the shoulders, kind of slouched forward. And lastly, do you think she's doing a good job or a bad job? Is this good or bad ergonomics?
Looks good.
Looks good to me too. Alright, this is the last slide of the presentation. Is this a good way to look at your cell phone or the bad
Good.
way? Absolutely, good job. Hope you guys learned a little bit tonight. I thank you for coming out. And yeah, take care.